So are you a nurse feeling burnt out by the bedside work? Or are you a student nurse wondering if nursing truly means hospital shifts forever? It's 2025 and the nursing landscape has exploded with innovative roles that will shock you and excite you at the same time. Do you also want to know how much these roles pay? So stay tuned for non-bedside nursing careers and the salary overview that's all gonna blow your mind. We are diving into a groundbreaking career path that leverage your medical knowledge in ways you never thought possible. Welcome to my channel, guys. I'm Nancy. I'm Nurse Nancy. Here we talk everything nursing. If you just got here for the first time, do not forget to follow for more about the nursing career and tips to succeed nursing school, and also for CNA schools, because you know CNA is the beginning of nursing. So number one would be clinical nurse review. So clinical nurse review role documentation to ensure accuracy, compliance, and quality. These nurses can work in hospitals, with government agencies, or with insurances. So you don't have to be hands-on with patients. You just go and do your checks and your rounds. This role requires an RN license, experience in clinical documentation and auditing. And how much are they making? They are making $75,000 and $95,000 a year. Number two, utilization review RN. So what do you get to do? Your role will be to evaluate medical necessity for treatment for insurances. So you have to have the RN license, you have to have a knowledge of medical billing and coding, and have a case management license. How much are they making? They're making about $72,000 to $92,000 a year. And number three is one of the most common and one of my favorite. It's a home health nurse. So what do? You work with patients in the house, okay? In the homes, you go visit them. You get to give them IV medications, wound care, admissions. You get to manage their care and the medication in general. Okay, so you work for insurance, you work independently, you make your own schedule, when to go see your patients and what day to go see the patients. So what are the requirements for that? You have to have an RN license. You can also have an LPN license. You have to be able to work independently, and you have to have some acute care setting experience, so you are able to provide all the skills and all the care that the patient needs. How much are they making? They are making between $70,000 to $95,000 a year. Number four is ambulatory infusion nurse. So your role will be to administer IV therapy medicine, chemotherapy medicine, antibiotics, and hydration in outpatient setting. The settings first, it will be in clinics, outpatient centers, and infusion centers. Requirements are, you have to be an RN with IV certification. You also, if you're working with a cancer patient and you're administering cancer medicine, chemotherapy, you have to have an oncology acute care experience, which is preferred, but they can always train you on that. The salary is between $75,000 and $100,000 a year. Number five is our dialysis nurses. We love them. We need them because as a bedside nurse, if I'm not trained as a dialysis nurse, I cannot administer dialysis for my patient with kidney failure. So I always get the dialysis nurses come and do the dialysis at bedside in the hospital, which is amazing. So like I said, you get to work with patients that have kidney failure, on hemodialysis or peritoneal dialysis. And where do you get to work? You get to come in the hospital, you bring all your material, you get to do what you got to do, you stay there the whole time, and then you pack and leave. Or in dialysis centers, or sometimes at home for our patients that get peritoneal dialysis and they get to do it at home. So what are the requirements? You have to be an RN, of course. You have to have dialysis experience, and you also have to have your certification and as a dialysis nurse, which is preferred. And then how much are you making? Boom, 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 $75,000 to $95,000. All right, stay tuned. We're still here. Role number six is transplant coordinator RN. Your role is to manage care of organ transplant patients, pre-transplant, post-transplant. So you get to teach families and patients how to take care of themselves after the transplant. Where do you get to work? You get to work with major hospitals and transplant centers. So for this role, requirements are a little different. You have to have your BSN or MSN. So as an RN, you can have an ADN and be an RN, but in this case, you have to have a BSN, be an RN, be with a bachelor degree in science and nursing, or you have to have a master's degree in science and nursing in most cases. Okay, and also you have to have experience in critical care, dialysis, organ unit management. What is the salary? You guess the salaries can be higher with the MSN. So salary would be between 75,000 and 110,000 per year. Number 7 is our public health nurses. I love this one. So where do you get to work? You get to work in community centers, you get to work for the health department, and you get to work for the NGOs, right? Isn't that amazing? So what do you get to do? You focus on community health, immunization, health education, and screening, blood pressures, diabetes, and all those comorbidities that patients get, especially in underserved communities, which is amazing. And what are the requirements? You have to be an RN, and you have to have passion for prevention and community outreach, just because you're going to be working with this underserved people. So you have to be passionate about it and be able to educate them, be able to reassure them and help them out when they have all these issues and they come to you as the nurse, because usually they don't even get to go for the yearly checkup. So it's just that pop-up that you get to do. That's the only way of seeing a medical person. So you get to be that person that get them motivated and teach them about how to self-care and how to reach for help when needed. And then how much are you making per year? It's between 60,000 and 80,000. Role number 8 will be our surgical center nurse, peri-operative nurse. Where do you get to work? Well, you get to work in ambulatory surgical centers, specialty clinics. So you get to work with surgeons, beauty surgeons, for example. When your patient comes for breast augmentation, reduction, or tummy tuck, or hair implants, or nose reconstruction, or anything that has to do with the beauty. So you are going to be that nurse that provide pre-operative care. You'll be teaching the patient, you'll be admitting the patient, you'll be the one telling them, teaching them, calling them to remind them about the surgery, and to be NPO after midnight, not to eat or drink anything, and how to get ready for surgery. And then the day of surgery, you will be helping during the surgery. You'll be prepping the patient, you'll be getting the anesthesia area ready, and also the operation room ready. So you are that nurse that helps out to get the patient ready. And what are the requirements? You have to be an RN and have to have a peri-operative nursing certification. And how much are you making? Guess, you're making more than 100,000 a year. Number 9 is my favorite. This is what I want to be. I see myself in 5 years as an aesthetic nurse. What does an aesthetic nurse? So an aesthetic nurse gets to have their own medical spa, or work at a medical spa, or work at a surgery center. Okay, so you get to provide patient with Botox, fillers, laser removal, and anything that has to do with cosmetics, skincare. Okay, so where do you get to work? Like I said, medical spa or surgery center. And what are the requirements? You have to be an RN. You have to have an additional certification in aesthetic, which you can train for that, and also have strong patient communication. As an RN, that's what we do. We communicate with our patients, so it shouldn't be a problem. So how much did you get to make? More than 120,000 a year. Isn't that amazing? Number 10 is our travel nurses. So this kind of still brings you back to bedside, but then again, you get to work on like under contract. So most of the time those contracts are 13 weeks. You get to work nationwide, right? In every state you get to travel, or internationally. So we have some international travel nurses. So what are the requirements? You have to be an RN, and you have to have 1 year to 2 years experience working in a hospital in a specialty, preferred, but 1 year to 2 years as a nurse. You are ready to travel. And how much do you get to make? Oh my God, between 2,000 and 3,500 per week. Okay, do the math. And also it's plus housing and plus food. So you get to work in hospitals, you get to be called for staffing shortage, or when there are strikes in some areas, they call travel nurses to come because patients still have to be taken care of. Number 11 is our nurse educators. I love, love, love my nurse educators because they get to teach all the new grads what they need to know for that specific unit, that specific hospital, and the follow up, and they like your coaches. They are amazing. So you don't get to provide any patient care. You just teach nursing students. You get to teach new grads in hospitals. So where do you work? I said it, in hospital settings, in nursing school, universities. Okay, what are the requirements? You have to have a master degree level to be able to and have some teaching experience. Okay, how much you get to make? Starting at 100,000 a year, which is so. Number 12, nurse leader. Nurse leaders, what do we do as a nurse leaders? So you get to manage the nurses in a unit. You get to enforce policies. You get to work on budget, and you also get to work on nurse staffing. Okay, where do you get to work? In hospitals, in nursing homes, and in clinics too. Okay, what are the requirements? You have to have a BSN or an MSN. And how much do you make? Between $90,000 a year to $130,000. Number 13 is forensic nurses. What does a forensic nurse? So you get to work with victims of crimes such as sexual assault, rape, or domestic violence. So you get to collect data, you get to assess those patients, and you get to testify in court. Okay, what are the requirements for that? You have to be a nurse, an RN. Okay, you have to have your RN license, a forensic nurse training, and you have to have the SANE training for sexual assault nurse examinator. How much you make? It's between 70,000 and 90,000. Number 14 is a legal nurse. What do you do as a legal nurse? Review medical records for attorneys, for insurances, and for legal cases. Where do you get to work? You get to work law firms, with insurance companies, or you can be an independent consultant, which is cool. You work for you're your own boss. And then what are the requirements? RN, you have to have your RN license. You have to have a strong clinical background. Okay, and a legal nurse consultant certification is preferred. It's not mandatory because you get to be trained. And how much do you get to make? You get to make more than 120,000 a year. Number 15 is military nurse. Hey, thank you for all your services. So what you get to do, you get to provide care for military members, families in bases, war zones, or in ships. Okay, what are the requirements? You have to have your RN degree, right? Your RN license, and also you have to be part of the military. You have to be Navy, Air Force, Army. Okay, and what is the salary? Between 60,000 and 90,000 a year, and then you get all the military benefits. 16 is a good one. It's actually taking off, is holistic nurses. What do you get to do? You get to take care of the patient holistically, mind, body, and spirit, which is so cool. So you have a whole, you take care of your patient, because in hospitals we just take care of the body, but not the mind and the body and the spirit, which I love. Where do you get to work? So you get to work in holistic health centers. You also get to work in integrative medicine clinics and private practices. So what do you focus on? Again, you focus on your patient as a whole, and you also take care of the patient. And the added things are massages, aromatherapy, and mindfulness, just relaxing and removing the stress, because it helps with healing the body. Love, love, love this. And how much, what are the requirements? You have to be an RN BSN, and you have to have a holistic nurse certification. It's a certification that takes maybe 6 months to get, and you get to take that online and then pass the exam. So how much do you get? Between 65,000 to 85,000 a year. Okay, so stay tuned. We have 2 more to go. We're almost there. 17 is nurse researcher. So what do you do as a nurse researcher? Your role is to conduct some scientific studies to improve nursing practices. Your role is to conduct scientific studies to improve nursing practice. and patient care outcomes. So you are like the advocate for patients and you advocate for your fellow nurses, which is amazing. In universities, in research institutions, and also in hospitals, but you're not doing bedside. Okay, how much do you get to make? You make up to 120,000 a year. So that's you working a 9 to 5, which is amazing. So the last one, number 18, is nurse surveyor. Nurse surveyor, what do? Your role is to make sure that hospitals and nursing facilities are compliant to the standards of the have the standards, so such as CMS and the Joint Commission. So you are the JCO and you are the nurse. You're a nurse and you can be part of the JCO. Where do you get to work? You work for government agencies and you also get to work for accrediting bodies. Okay, what are the requirements? An RN, you have to have an experience as RN. You have quality assurance and also have to have knowledge of healthcare regulation. You make up to 100,000 a year. So the non-bedside nursing careers that you have out there. So guys, like I always say, nursing is such a beautiful career because you have so many paths that you can take outside of bedside. And this is only outside of bedside, and inside bedside you have also a lot of things that you can do. Work with babies and mommies, work in ICU, work with cancer patients, med-surg as I am. So yes, stay tuned for more in nursing, and please remember to like, share, and subscribe. This is your way of supporting your girl, so YouTube can know that you are liking my content and they can share it to more people, and I get to earn a living as a content creator. So stay blessed, love always, and come back for more.